It's my pleasure to be here. I think this is my third time. I was lucky enough to the very first meeting was said, and I have to say this is really impressive that number one is have been continuing, and number two, it has large audience, and the agenda is very, very impressive. Just a little bit of my background. I have the privilege to work in telemedicine, telehealth industry from different angles. Initially, as a CEO of a company, as a vendor which developed the hardware, software, then had an opportunity to work in an organization which delivered telehealth, and then finish up with 4 years with United Healthcare, where they are the payer. For this presentation, I was asked to give a little update on reimbursement on telehealth, and that's really where I'm going to focus the presentation. Initially was just asking about the virtual care, but now as we look at there multiple areas of reimbursement is not just the video consultation or one set of reimbursement. So before we go there, as United Healthcare, this was the chart that I use the most. Anytime the new opportunity, new technology will come, we will put through this test. What you're seeing here in the center, you have 4 quadrants. And any solution we're looking at adopting or reimbursing, we put through, A, what does this do to the patient themselves or the caregiver? Are they going to accept this solution versus gold standard in-person care? On the right, you have on the provider side, how is that information that the solution you're doing is going to help the workflow of the clinician? Is it going to be efficient for them, or is it going to create a lot more work for them? Then coming in the bottom, the left is the payer. And the payer, when we look at it, is really, there are multiple payers. The federal government, the state government, the employers. A lot of time people do not appreciate in the US, over 100 million people get health insurance through the place they work at, and those employers are self-insured. Now, the insurance companies are providing the administration, so they're carrying a health insurance card that says United Healthcare, but it's really sponsored by the employer who's taking the risk. And then you have increasingly self-payment. There are policies that are high deductible, as well as people who did not have insurance. And then on the last, not the least, is the regulatory aspect. Is this, and there are 2 aspects of regulatory. One is the safety and efficacy, like FDA and other organizations. But equally important is the medical boards, and this is going to be allowed to practice. In the US, each state has their own medical board, and they have their own guidelines their physicians have to follow. So as we look at the reimbursement, this is the chart. As an insurer, they have a larger population, they are insuring it. And what I've done is kind of group them into 3 sections. As a payer, you want to have the largest part of your members stay healthy. In the past, they just prayed that they stay healthy, but now they actually are investing money into it. As part of Affordable Care Act, there is a reimbursement for annual physical checkup, as well as there are incentives that I mentioned, 100 million people buying insurance through employer base. And increasingly, employers are giving annual incentive in terms of reducing their premium if they show that they are taking care of themselves, being healthy. So the 75%, this is just arbitrarily with some information I have. Obviously, it will change from population to population you're working for, but thereabout is where you want to be. A lot of information and a lot of attention, and the dollars go into when people not healthy, you want to help them get healthy as quickly as possible. Again, in the past, it was always going into hospitals, doctors, or emergency. increasingly virtual health is playing an important role in terms of telemedicine, and oftentimes this requires video consultation. But then you have another 20% or so population where they have chronic conditions, and they're living with this, and this is where remote patient monitoring and other behavioral aspects are working into this set of population. And the reimbursement for each of the groups are different, the technology is different, and I would like to give you a little bit of examples of those as we go forward. So again, who pays for healthcare? Once we've gone through the analysis, and the criteria are very similar. Oftentimes, as Dr. Darkins just mentioned, he did the study at the VA or the scale that provided the evidence, and that is being then followed by the private health insurance companies with the evidence. But the first big payer and increasing burden is the CMS for people over 65. They are entitled to get the Medicare coverage. And they have traditional Medicare, which they're just buying from the insurance, from the government, but also they have managed Medicare where some insurance companies are managing, and they're adding some additional features for them. And I capture right here Department of Defense and Veterans Affairs that Dr. Darkins was mentioning. That's also paid by the federal government healthcare delivery. Next. Then you have each of the 50 states have their Medicaid program. This is primarily designed for people who are below certain income level. Then they are being provided health care through the state. And they have, each one has very different criteria. As far as the telemedicine, telehealth, there are increasing lobbying as well as the pressure to increase coverage for telemedicine, telehealth. As of now, there are 31 states have some kind of telemedicine reimbursement act that has passed, and very rapidly is going to the remaining in some aspect of telemedicine, telehealth. Then the biggest part is the self-insured employer, and I'll get to in a second, but this is where we're seeing big change, and that I personally feel will translate into some of the other areas where we have the evidence, but it just wasn't moving the needle. As of now, over 90% of the employer is sponsored. So if you look at the statistics, I said 100 million, 90% of those plans are covering telemedicine, especially in this case is virtual telehealth, and I'll come back to in a second. And then you have insurance companies. They are now, initially they were starting with administering the employers, but now they are providing their own on risk after a year or two. So all United Healthcare, Cigna, Aetna, Humana, WellPoint, and Blue Cross Blue Shield, these are the big ones, national, and they all have, and at the end I will show you some of the recent announcement that are coming, which is very favorable for telemedicine industry, which I'm very happy. And then we said self-pay. Again, the virtual telehealth, there's a couple of companies have started. They're trying to go direct to the consumer. It's harder to go to direct to the consumer, but you can get for $49 a 10-minute consultation with a registered physician. And now the data is very favorable that in this, the fear was that this is going to create an extra visit. At 10 o'clock at night, you have this consultation, and then they're going to say in the morning, you come to the doctor's office. Then that has provided the convenience, but it added another cost to the healthcare system. But it actually shows over 80% of the consult really completes their visit. So these are, the previous slides show you who are the payers, what kind of the model they have. overall reimbursement and telemedicine is now enabling. So first is the traditional fee-for-service model, and as a telehealth industry, we were stuck in there. We were saying, well, we need to have a reimbursement line item just for telehealth technology use, but then in addition to the fee-for-service. Well, you don't get an extra line item reimbursement to use MRI or others. Sometimes you have lab tests done, but when the doctor is providing your delivery, it's all built in. So as we're moving towards the capitated or negotiated rate, it started with CMS, the private health insurance companies also very rapidly moving in this area. Whether these the acronym ACO, Accountable Care Organization, where 2 or 3 healthcare providers, they come together and they get an overall payment to take care of a certain part of the population that they are looking at. And they get paid based on previous 2 or 3 year costs, the healthcare costs, and if they are saving, that they get bonus on as a reward to providing. And there are some very explicit quality and satisfaction metrics that has to be met. Next one is centric medical home. This is the area where you're bringing the technology to the patient's home, as well as in the smaller community where apartment complex and other where group of patients could be living on. Then you have bundled payments. This is where for a procedure, there's a fixed amount of money, and that includes the facilities, the providers, then medication and others. They're all bundled together, and also similarly episode of care. These are increasing. Last year CMS started for joint and knee replacement, and they already announced their intention to include cardiac next year very rapidly. I already mentioned some of the employer are reimbursing or giving incentive if one does the wellness part. So nutrition, activity monitors, and for prevention is reimbursed. And also there's much more flexibility in what we call pre-tax spending. So here's a certain amount of person is able to put in these accounts before any tax, income tax and local tax, and they can pay from this to the healthcare services, and of course the self-pay. So one of the things CMS has done is to move the chronic care, move it towards the primary care, a physician. In the US, it has been fragmented. Upon acute care, when the patient is discharged, sometimes they are going home with home health services, then they are following. Sometimes they're just going home and there's really no correlation. So they just started last year. Not a lot of money yet, but it's being tested about between $43 to $49 per month for 20-minute care coordination that the physician's office is doing. Their thinking is now there will be a connectivity with chronic care patient, and it just came out last year. Adoption, like anything, is being slow. Initially, people, the doctor's practice say it's just not enough money. They can charge more for just seeing for 10, 15 minutes. But now the technology and other partners are catching up, and there are models emerging where they can have a large number of patients could be monitoring. Next slide. So I want to finish up with, within the last month, there are several new development that has come out. As in the US, about this time of the year, in September, October, once every year, we have Medicare, eligible people have to re-enroll between October to December. So the new plans have to be announced. And similarly, all the employer-based insurance program, they have yearly enrollment. So this is the time when new changes, they are already introduced. So next, so there's several announcements that I want to show. The next, please. So one of the One is the Aetna insurance companies have just announced, these are all within the last 30 days, so you can Google search, there's press releases and so forth. Next one is, this is a big one. This is a big one. We have to see that Aetna has partnered with Apple, and they are going to pay for Apple Watch for their employer base, but Aetna as an insurance company has 50,000 employees. All of their employees will be eligible to get a free Apple Watch and healthcare app. Only thing they require, they need to be submitting their agreed upon activities and other wellness measure. Next one, please. Cigna is another one. They announced again within the last 30 days a major expansion of their telehealth program. They have been reimbursing for telehealth, and now they have just announced they're going to be reimbursing for behavioral telemental health coverage and consultation for psychiatric conditions. Next one, United Healthcare major announcements for redesigning for their Medicare product, and starting 2017, they're going to be reimbursing a large portion of their Medicare program. They have a product called Optum Care. This is the United Healthcare healthcare delivery services, and they are including a lot of care coordination and remote monitoring. Blue Cross Blue Shield, they're 29. They are the brand of Blue Cross Blue Shield, but each state has different. 29 states have the program, and I think there are two more. Just go ahead. Next, please. Now, in addition to insurance companies, there are two, there's one more, go ahead, please. So there I wanted to leave you with, one is the UPMC, the University of Pittsburgh Medical Center in Pittsburgh. They have now, they're offering a new telehealth program for their nursing patients. So they have vertically integrated. They said, this is how we're going to offer. And then the last one I want to mention, within the last 30 days, there was CEO of Kaiser Permanente was quoted in Forbes magazine that this year, first time, they have 52%, more than half of their physicians encountered the patient has been using the virtual connectivity, not all telehealth, sometimes they're using the smartphone and others. And they had 100 million encounters between patient and their providers. So huge number of interaction. Again, they are able to do it because they are what we call, just like VA, they are integrated delivery system. They own the facility, they have the insurance, the payer, as well as the providers. So there's a lot of exciting things that are going on, and I've been very, very pleased as to how the reimbursement, and to me, having over 90% virtually all employer-based program, health plan, having reimbursement, this is really going to expand into all different areas. I thank you for your time.